Today we're going to talk about sacroiliac joint braces. Indications for these braces are anyone who's got a sore lower back, particularly SIJ sprains or strains. These do make a significant difference, and I noticed that every clinic's got hundreds of these, but no one's using them. Anyone who comes in with an SIJ sprain should be recommended a brace. They are easy, they're really effective, and guess who looks good if a patient feels better who wears them? So a couple of basic steps about how to recommend these braces. So typically I would do all my adjustments, all my treatment, etc. And then I'd say to the patient, hey Emma, could you take a seat on the table? I'm just going to put this brace on you, we're going to see how it feels. So that's how you introduce it. Then if you come over here, you would typically line up the centre of the brace, put it right over the SIJs, and then if you could do that up, Emma, left over right, great. Now Emma, there is some little Velcro strips here. If you want to grab that with your left hand, and then grab this one with your right hand, here, grab that, and then bring it right around to the front. Okay, let's have a look. Okay, now standing up.
Yep.
Have a walk around. How does that feel?
Feels great. I can feel it on my back. It feels amazing.
It feels supportive?
Yeah, supportive.
Now, Emma, do you see yourself wearing this for the next week?
Yeah.
Is it something you can do? Do you feel the benefit, the support?
Yeah, I
It's
can
not
feel
too
that support.
Okay. Oh, great. So Emma, today I've put it over your clothes, but normally you would do this first thing in the morning, put your undies on, and then put on the brace, then put on your clothes at the top. Now, you do not wear this to bed, you wear this when you're active. If you go to the bathroom, you probably take it off. Wear it continuously throughout the day for the next few days, and then typically switch to only wearing it when you're doing something strenuous, bending, twisting, etc. This is going to help the healing. It's also going to hold the adjustment that we've just done on your back. Make sense?
Yep.
All right, well, let's you might as well leave it on for now. We'll come down to the front and we'll check in with your next appointment on Tuesday. Great, come through.
Thank you.
Hey Mary, so Emma's going to grab that brace, she's already wearing it, it's a medium size, can you just put that through? Talk to you then.
Thank you.
And then you'll disappear. Now, a couple of little points. So the braces come in small, medium, large and extra large. Emma would be an extra small or a small. Typically, not many people are extra large. Me personally, I like to have a medium. And it's about keeping it really tight and in position. Other tips would be you should have a demo in the clinic, otherwise just open one up. The other points would be, come over here Jay, so these straps, you want to bring them as close in as possible. If these straps are overlapping each other, it means that the brace is going to be too big. If you come over here Jay, so the middle of the brace is going to be right here, you want to line it up. So these braces are, I used to work on Sundays, I used to see a lot of acute patients. These are something that I would, maybe for every 10 patients, maybe 3 of them had lower back pain or had SIJ issues, I would recommend them. And presenting it in that way, it's such an advantage for the patient. There shouldn't be any pushback. So the key point would be to get that commitment. It's, Emma, do you see yourself wearing this?
Yes.
Okay. Is it supportive? It's not hurting you in any way?
No restriction.
Okay. As soon as she says that, that's commitment. You don't need to then go to reception and say, hey Mary, this is Emma, she's going to get an appointment on Tuesday. Now in terms of the brace, is that something you want? That's kind of weird. We've already had the conversation in the room, we've got that commitment. So I hope that all makes sense. If you don't have any of these in stock at your clinic, just reach out to Jade, she'll get some to you. Otherwise, everyone should have them. I want you to have a play around with them. I would also recommend that you as the chiropractor, you put it on, you feel that support. It's awesome. I used to also tell patients, Emma, once we finish using this in the next week, typically put that in the cupboard, and in the future, if you ever need it again, you can whip that out. They are $65 is the cost. Look, it's $65 well spent for your patients. And again, you look better if the patient feels better. Thanks, guys. All right.